The name of our group is Preventative Care Institute, and we Cancer Institute, and we basically chose that name because we think it's better to catch cancer early and prevent it, and that would help cut costs overall. Our objectives are to focus on cancer of the breast, brain, lung, skin, prostate, and cervix, and provide low-cost cancer screenings, prevent cancer for patients with a family history of cancer or not, reduce the competition and the conflicts between hospitals and physicians, and use EMR. Our main goal will be to lower the cost and concern for every patient. We want to prevent cancer for everyone. The faster we're able to catch it, the faster we're able to treat it. We have 8 offices, and they'll be in Wilmington, Newark, Dover, Laurel, Lewis, Long Neck, Milford, and Seaford. And this is our basic insurance mix, and we'll have Medicare, Medicaid, Aetna, Blue Cross, self-pay, and commercial insurance. Those are the percentages. This is basic number of physicians. We'll have internal medicine radiologists, gynecologists, neurologists, PCPs, and nurse practitioners, and a dietitian for the obese. The second highest cost of death in the United States is cancer, second to only heart diseases, and that's 23.2% of deaths in the United States.
And things that can increase cancer is growing older. Growing older is the number one, well, this is the single most, single biggest risk factor. The reason for that is because the older you get is the more unstable your cells are, which leaves you vulnerable to diseases and other types of viruses. Tobacco usage, smoking can kill away your, it can cause lung cancer. Sunlight exposure, too much radiation can lead to skin cancer. Ionizing bacteria, that one, it's just basically a type of, it's a type of frequency, type of radiation. Too much exposure to that one can cause issues with DNA and genes. Certain hormones that can also lead to skin cancer or cancer of the lung. Family history is another huge one. It doesn't cause cancer, but it increases your risk of actually getting cancer. Alcoholic abuse, that could help harmful chemicals get into your system. And obesity, that's another major one. Too much chemicals or too much excess fat in the body can produce more hormones, which can cause problems. Family risk. 2 or more drinks a day, every day, increases the chance of cancer of the mouth, the throat, esophagus, larynx, liver, and the breast. Obesity in families can run the risk of colon cancer, cancer of the uterus, prostate, breast, esophagus, and the kidney cancer. Regular screenings. We recommend regular screenings at least once a year in order for us to detect any cancer that could possibly be there, so we could treat it early if necessary. And then we offer genetic testings. Cancer, other risk factors include most occurring cancers. Cancer usually occurs mostly in people 65 or older, as again, because the older you get, the more unstable your cells are. Smoking increases lung cancer, exposure to asbestos, benzene, benzodrine, cadmium, nickel, and vinyl chlorides. Years of skin cancer can cause from tanning. Viruses such as HPV can lead to cancer. Women who test for DES during pregnancy can increase the risk of cancer in children. We recommend regular checkups and screenings for people in those categories. Cancer symptoms include fever, fatigue, weight loss, lung cancer, high blood calcium levels, skin changes, pain such as headaches or back pain, sores in the mouth, unusual bleeding and other discharges, and nagging coughs that don't go away. These are the testings that we offer: CT scans, the flow cytometry, mammogram, PT scans, tumor markers, nuclear medicine imaging, and X-rays and ultrasound.
In order to get treatment for breast cancer, the following conditions must be present: the type and stage of the breast cancer, if the breast cancer cells are positive for receptors, if she has had previous treatment for breast cancer, and lastly, the patient's age, health, and preference. The American Cancer Society states that women aged 40 or older should have an annual mammogram and a clinical breast exam as part of a periodic health exam. Women should know how their breasts normally feel and report any changes. A breast self-examination is an option for women in their 20s. And the following treatments we provide are surgery, removal of a lump, chemotherapy for early stage breast cancer and advanced stage, radiation therapy which reduces the risk of breast reoccurrence, hormonal therapy lowers the amount of estrogen to block cancer cells. And the treatment can run around $17,000 to $27,000 per woman for the first 5 years of treatment, depending on the stage. And the way we can cut costs is by having routine gynecology checkups with the patients.
Brain cancer depends on the age, the stage of the disease, type and location of the tumor, and whether the cancer is a primary tumor or not. The brain cancer treatments we offer are those four: craniotomy is a surgical operation in which a bone flap is removed from the skull to access the brain. Patients will undergo EKG and a chest X-ray to make sure the patients can receive a craniotomy. And MRIs are also used for suspicion of tumors. The cost of brain cancer, if you use chemotherapy, can range from $100,000 to $30,000 for 8 weeks, and depending on the treatment, the overall cost for brain cancer would be $80,000 to $200,000.
Lung cancer treatment is the treatment for lung cancer. The treatment for lung cancer depends on several factors. Two of them are the histopathology type of lung cancer and the stage of the cancer. We offer a couple different lung cancer treatment. The surgical resection is the cutting away of any tumor, as far as the patient who have not had it spread, so that it's just to prevent the cancer or the tumor from spreading. The thoracotomy, that is performed through the chest wall. The median thoracotomy, that's the cutting away of the breastbone. The anterior limited thoracotomy, that is performed on the frontal chest using a small incision. We offer anterior and axillary thoracotomy, that is performed on the frontal chest near the underarm. Another one is the photodynamic therapy. It just basically treats inappropriate cancers. And the cost treatment for lung cancer, the average hospital stay in 2006 was $14,200.
Skin cancer treatments will include surgery, which is going to be the most basic one, removal of the cancer, liquid nitrogen freezing the cancer, low-dose radiation, chemotherapy, radiation, and immunotherapy, which kills the cancer by manipulating the body's immune system. The cost of skin cancer is the most expensive in 2001. The treatment of non-melanoma skin cancer was $264 million. Non-melanoma skin cancer was the most commonly diagnosed cancer. And for prostate cancer, therapy includes brachytherapy, where small radioactive seeds are implanted into the prostate where they irradiate prostate tissue. And we also offer chirotherapy. Thin needles are inserted into the prostate and cold gases flow through